All right, let's talk about something that is absolutely critical to your recovery journey: staying hydrated after bariatric surgery. It sounds simple, but it's a whole new ballgame now.
And just to show you how important this is, let's start with a number: 3.5%. Studies show that about 3.5% of patients actually get readmitted to the hospital within a month after a sleeve gastrectomy. And a huge reason for that: dehydration. It's a major concern.
So, we're going to break this all down into 5 clear sections, just to give you a solid plan. First, we'll get into your new hydration priority. Then we'll look at how to spot the warning signs of dehydration. Next up is that 50 to 60 ounce goal and what it really means. After that, we'll cover some really smart sipping strategies. And finally, we'll wrap up by talking about knowing exactly when to ask for help. Okay, let's jump in.
First up, let's get our heads around why hydration is suddenly at the top of your priority list. I mean, your body has gone through some incredible changes, and that means your old habits have to change right along with it.
Here's the most crucial point. Because of the surgery, your stomach is so much smaller now. It just can't hold as much as it used to. This makes dehydration a very real and kind of constant risk. So that old habit of just chugging a big glass of water whenever you're thirsty, yeah, that's off the table now.
Okay, next. This is so important. You've got to learn how to listen to your body. Think of it like you're developing a new superpower, learning to recognize the signs of dehydration, from those first little whispers to the much louder shouts for help.
And you can really see how things can progress here. On the left, you've got those early signs: feeling extra thirsty, seeing that your urine is dark yellow, a dry mouth, or just feeling wiped out. Catching these is everything, because if you ignore them, they can ramp up to the more serious signs you see on the right: dizziness, a racing heart, or even feeling confused. Our goal is to live on the left side of this list and never even visit the right.
So how much should you actually be drinking? This can feel like a big mystery after surgery, but don't worry, the clinical guidelines give us a really clear target to shoot for. It takes all the guesswork out of it.
Okay, so the official recommendation is to get between 1,500 and 1,800 milliliters of fluid every day. And I know what you're probably thinking. What on earth does that even mean in the real world?
Well, to make it super simple, that's the same as about 50 to 60 ounces. That's your magic number. That's the daily goal you want to keep right at the front of your mind.
And when you break it down like this, you can see how manageable that goal really is. It is not an impossible mountain to climb, I promise. We're just talking about 3 or 4 of those standard water bottles you see everywhere. Or maybe just filling up your favorite 20-ounce tumbler 3 times a day. See, when you look at it like that, it feels totally doable, right?
And now, maybe the most important part: the how. Hitting your goal is not about forcing yourself to chug water. In fact, that can actually make you feel nauseous. It's all about developing new, smart habits that work with your new body, not against it.
Think of these 4 steps as your new hydration game plan. Number 1, sip, don't gulp. Seriously, be a constant sipper, taking small, slow sips all day long. Number 2, time your fluids. Try not to drink with your meals. Give it about 30 minutes after you eat before you start sipping again. Number 3, ditch the straws. They can sneak extra air into your stomach, which can be really uncomfortable. And 4th, choose wisely. Let's take a closer look at that one.
Okay, this table is basically your cheat sheet. On the left, these are your new best friends for staying hydrated: water, broths, even things like sugar-free Jell-O. On the right, these are the things you want to limit or just avoid completely because they can actually work against you. I'm talking about sugary and carbonated drinks, caffeine, and alcohol.
And I really want this to sink in. Your body is healing. If you try to push it too hard, drinking too much, too fast, you can end up with nausea and vomiting. That just sets you back even further. It's literally counterproductive. You have to listen to your body, be patient with yourself, and remember that slow and steady truly wins this race.
All right, finally, let's talk about your safety net. Because being prepared is a huge part of your success. It is just as important to know what to do and who to call when you're feeling like you're struggling.
Having a clear 3-tiered plan like this just removes all the guesswork and panic. So, Tier 1, if you're consistently having trouble meeting your goals, or if those early symptoms just won't quit, call your bariatric team. Tier 2, if your team recommends it, outpatient IV hydration can be a fantastic way to get a boost and get back on track without needing a hospital stay. And Tier 3, this is the most important one. If you experience any of those serious symptoms we talked about, confusion, a really fast heartbeat, extreme dizziness, that's an emergency. Seek emergency care right away. Please don't ever hesitate to use these resources. They exist to make sure your recovery is as safe and successful as possible.
So as we finish up here, I just want you to think about this. What is one small positive change you can commit to this week to really master your hydration? Maybe it's just carrying a water bottle with you everywhere you go, or setting a little timer on your phone to remind you to sip. Whatever it is, pick one thing. You've totally got this.